Hello, my name is Dominique Cross. I will be talking about hypertension and the effects that it has on the endocrine system, more specifically, aldosteronism. I am a student at Indiana State University. This is Community Health 444, and this is my health education project number 5. After completion of this video, the student will be able to explain the background of aldosteronism, identify the causes and symptoms of aldosteronism, recognize the complications of aldosteronism, discuss the diagnosis for aldosteronism, and list the management and treatment associated with aldosteronism. At this time, you can pause the video and take the pretest. Click on the link below in the comments section and test your knowledge. So I'm going to tell you a bit about endocrine hypertension. It is a type of high blood pressure caused by a hormone imbalance. Most often, these disorders originate in the pituitary or adrenal glands and can be caused when the glands produce too much or not enough of the hormones they normally secrete. There are several types of endocrine hypertension, including primary hyperaldosteronism, which is also called Conn syndrome. It is a condition that occurs when the adrenal glands produce too much aldosterone, the hormone responsible for balancing potassium and sodium in the body. The second type of endocrine hypertension is pheochromocytoma. The tumor releases hormones that may cause high blood pressure, headache, sweating, and symptoms of a panic attack. If a pheochromocytoma isn't treated, severe or life-threatening damage to other body systems can result. The third type of endocrine hypertension is paraganglioma, a type of neuroendocrine tumor that forms near certain blood vessels and nerves outside of the adrenal glands. Causes and symptoms of aldosteronism results from benign or non-cancerous tumors in one or both adrenal glands and occur in people between the ages of 30 and 50 years old. Rarely, primary aldosteronism occurs because of an inherited disorder. In extremely rare cases, cancerous tumors in one or both adrenal glands cause primary aldosteronism. Primary aldosteronism generally causes high blood pressure with low potassium. Other symptoms may include excessive thirst, fatigue, frequent urination, headache, muscle cramps, visual disturbances, weakness, and tingling. The diagnosis of primary aldosteronism, or Conn syndrome, is measured by the levels of hormones like aldosterone and renin, along with electrolytes, including sodium and potassium in patients with high blood pressure. Electrolytes are minerals that help balance the amount of water in the body. Other tests to rule out adrenal gland tumors may include CT scan, which is computerized tomography scan, which uses X-rays to create pictures of internal body structures. Also, magnetic resonance imaging, MRI, using radio waves and high-powered magnets to visualize the inside of your body. Signs and tests for primary aldosteronism include low serum potassium level, abdominal CT scan that shows adrenal mass, elevated plasma aldosterone level, elevated urinary aldosterone, low plasma renin activity, ECG that shows heart rhythm abnormalities associated with low potassium levels. Management and treatment of primary aldosteronism consists of spironolactone or aldactone, or eplerenone or Inspira. Those are the two choices of treatment. if extra aldosterone is produced by both adrenal glands. These drugs block the effects of aldosterone. If it is produced by one adrenal gland, removing that gland is an alternative to those medications. Primary hyperaldosteronism resulting from an adenoma, which is a tumor, is usually treated surgically. Removal of adrenal tumors may control the symptoms. Even after surgery, some people have elevated blood pressure and require medication. Your doctor may also recommend lifestyle changes, which include frequent exercise, limiting alcohol intake, reducing sodium in your diet, dietary sodium restrictions, and administration of medication may control the symptoms without surgery. And the last thing for lifestyle changes will be smoking cessation. Complications of primary aldosteronism, electrolyte imbalances and prolonged high blood pressure increase your risk for serious complications. A few of these complications include heart attack or heart failure, irregular heartbeat, kidney failure, stroke, temporary paralysis or the inability to move, impotence, and gynecomastia. And gynecomastia is enlarged breast in men, and it may be associated with long-term treatment in men. There is no way to prevent primary aldosteronism or to cure primary aldosteronism. Just monitoring your blood pressure frequently can help spot problems. As for the prognosis of primary aldosteronism, patients with primary aldosteronism can be managed with medication. The prognosis for primary hyperaldosteronism is good with early diagnosis and treatment. If the aldosterone is coming from a tumor in one gland, it can potentially be cured by surgery to remove adrenal gland tumors. I do thank you for listening to this video. I hope you enjoyed it, and as well, I hope you learn a few things about primary hyperaldosteronism and hypertension and the effects that hypertension has on the endocrine system. At this time, you can take the post-test and see how you did with the pre-test. Click on the link below in the comment section of this video to test your knowledge. Thank you.